Hello, I'm Nancy O'Neill. This week we'll explore breast lift surgery with Dr. Sessa, osteoarthritis with Dr. Hornberger, and find out more on the health benefits of dance from Tiana Ramirez. All right here on Aging Gracefully on Suncoast FYI. Continuing our cosmetic breast surgery discussion from last week, Dr. Sessa returns today to talk about breast lift surgery. Hi, welcome back.
Thanks.
Welcome back. So let's start. How does someone know if they need a breast lift?
So, I alluded to this last segment, but initially when you come to for a consultation, I take measurements. So there are certain measurements that sort of lead me on to think that you would need a lift. And that main measurement is when I measure from the sternum or the collarbone down to your nipple. Now everyone's different, but it really depends on where your inframammary crease is. So if you look in the mirror, the simplest and easiest thing to do for somebody at home would be, if you look in the mirror and you turn to the side, and you can see the outline of your inframammary crease, and then you'll see where your nipple falls. If your nipple sits just below the fold or very below the fold, then you need a lift. An implant alone will not lift the breast.
Interesting.
Yeah, it will not. The implant makes your breast larger, but it will not raise the nipple.
Okay, so you basically need a combination of an implant and a lift.
Well, sometimes. I mean, if your breast is large enough, then you just get what's called a mastopexy or a lift.
Okay.
And that's just a procedure where I just raise your nipple up to the desired position, and then it would have a more conical, more youthful appearance as it sits higher on your chest and not very low. And is able to fit in a bra properly. Okay, so those are probably the biggest reasons why people sort of look into this surgery. Is they just can't really fit in a bra, they can't really fit in clothing, or they're just unhappy with the way that their breasts look, and they want them to look like they used to look. So what's involved in this surgery? There's a whole litany of types of lifts that you could get. So some of the types that you could get are just simple little nipple lift, or something I call the crescent lift. And that's just something very simple where I just make a small incision at the top of your nipple from the 10 o'clock to 2 o'clock position, take out a little wedge of skin, and just raise the nipple. A lot of times that's enough if we're adding an implant at the same time. That's enough to give a lift, or the lifting appearance. If you need a little bit more than what that can provide, then we actually go around the nipple, move the nipple up. Now, some people sort of incorrectly say, oh, so you take the whole nipple off. No. When this surgery is done, you're not removing the nipple. The way that this surgery is done is you're actually moving all of the blood supply and the nerve supply, along with breast tissue, just higher. Okay? But when you do that, you actually make the breast smaller. That's the reason why we actually have certain incisions. In order to raise it up, you actually have to remove breast tissue. It's just the way that the surgery is performed. So, and sometimes to counteract that, we add an implant.
Okay, so can you have the implant and the lift surgery done at the same time then?
Yeah. So, in certain instances, if it's a real big movement, I'll recommend it's done in 2 separate stages. Just for safety purposes and to decrease the amount of complications that could potentially occur, it's better to do it in 2 separate surgeries. But in probably 90 to 95% of all of the surgeries where people come in looking for lifts, I'm doing it as a combination, because most people like the fact that you have one surgery and it rejuvenates the breast. When you do a combination lift with an augmentation, of course it could be used with silicone or saline, depending on what the person's preference is, as well as we'll have a discussion about that during the consultation. But most often as I limit the size that the person can go to, because if you think about it, theoretically, as the breast is lifted, it's made smaller. So if I'm also going to be putting an implant in now to make it bigger, it's counterintuitive to the tissues. So the larger you go, the higher the risk of complication. So I try to sort of keep people's expectations in line with, you can't get a lift and have massive breasts at the same time. If they do want that, it's a two-step surgery, which is okay. And it's ultimately safer to do that, but it will ultimately get them what they want if we do it as a two-stage surgery. Okay. There's a higher degree of uncertainty when you do the lift with the AUG. However, that uncertainty is very, very small. I could probably give most people 95 to 98% of what they're looking for.
That's excellent.
By doing this combination surgery and safely.
Great.
Yeah.
How about bruising and swelling after this?
So the typical recovery for a lift with an augmentation, if it's just a lift or and I'm not doing an implant, typically that's just a few days of some mild discomfort, maybe a week out of work at most. If we're doing the combination surgery, a little bit more soreness, maybe 3-4 days, still about a week out of surgery, about a week out of work. But the real kicker is most of my patients are very active, so generally 2 to 3 weeks from intense workouts.
And they're back. Wonderful. Yeah. That's very doable. Great. Well, thank you again for being with us. We'll see you next week.
My pleasure.
Tune in to next week's episode for another segment on cosmetic breast surgery with Dr. Sessa. Aging Gracefully will return after the break. Dr. Hornberger is here today to prompt us on our next discussion about arthritis. Thank you for being back and joining us.
Absolutely. Thank you for having me.
I really want to hear about this. So many people, as they get older, find that they have arthritis. So what exactly is it?
Well, arthritis is a very general term. In fact, there's over 25 different types of arthritis. But to simplify things, we'll classify them into inflammatory and non-inflammatory arthritis.
Okay.
Inflammatory arthritis is actually due to an immune system condition where your body is attacking itself in the joints. That's not as common as the non-inflammatory type. Non-inflammatory arthritis, you may have heard this term degenerative joint disease or osteoarthritis. And that's a very common type of arthritis that we get as we age.
Okay, now what are the symptoms of osteoarthritis?
The symptoms of osteoarthritis, typically the person will complain of pain, stiffness, and lack of mobility in the morning as they wake up. And then slowly throughout the day they'll get moving and those symptoms fade away, they'll feel better. And then again toward nighttime when they're going to bed, those symptoms tend to come back.
Okay, and what can cause osteoarthritis?
Well, many different things cause osteoarthritis. Medically, it's the loss of cartilage, which is the padding between the bones. And so when that padding starts to deteriorate, the bones actually start to rub together and you get this bone-on-bone situation. Accidents can cause arthritis where joints will misalign. And then over time, 5, 10, 15 years, if that joint is untreated, you'll develop this arthritic condition.
Okay. Now, what's the difference between arthritis and osteoarthritis then?
Well, osteoarthritis is a non-inflammatory type of arthritis.
Okay.
It's the cartilage degenerating in the body and the bones rubbing together.
Okay.
Arthritis is a general term. It can include inflammatory or non-inflammatory.
Okay. Thank you for clearing that.
It is a little confusing.
No, but that's good. Now that makes sense. How can chiropractic services, how can you help with osteoarthritis?
Well, this is a great question because not only can chiropractic help the condition, it could either slow the condition if you already have it, stop it, or prevent it from ever coming. So as chiropractors, we treat subluxations, which are misalignments in the spine. And these misalignments can so far cause a kink in the spine. And as you can imagine, over time, 5, 10, 15 years of having a kink in your spine, that could cause the joint to deteriorate or wear out incorrectly. So as a chiropractor, we're going to treat these subluxations and realign the spine, which takes pressure off joints and establishes the mechanics in that joint. In my office, we do a specific stretching, and this stretching actually focuses on finding the locked up joints and then separating the surfaces. So we're actually pulling those surfaces apart, and that could dramatically reduce the pain. That could help to reestablish the mechanics of the joint. It decompresses the nerves that come out of the spine in that area. And most of all, it will rehydrate the disc. And the disc is a pad between each vertebra, and it doesn't have any blood supply to it. So the only way it gets blood supply is through movement. But if that segment is locked up from arthritis, that disc is going to degenerate. So as we stretch, it's pumping blood and oxygen and nutrients, which is going to help prevent further arthritis.
Okay, so you can you say that you're reversing this situation, or you're just stopping it from progressing, or a little bit of both?
Well, if you don't have arthritis, we can prevent it from happening. If you have arthritis, we can still help. We don't reverse arthritis. It is what it is. Once you have it, you're mostly likely going to have it. But the key is to get it functioning as best as possible, and we could slow down or prevent it from getting worse.
So doctor, can you tell us a little bit about your practice here in Sarasota?
Absolutely. So we've actually been established for 30 years now. My father's been in practice for 30 years. I decided to join the practice a couple of years ago with him. I decided to be a chiropractor because I saw him help so many people. And as a kid, I was in athletics, so I was constantly injuring myself. He was constantly fixing me.
There you go. How perfect, though.
Exactly. So I decided to follow in his footsteps, and it's really been a blessing. In our office, it's really the perfect situation for a patient because I had the latest and greatest chiropractic techniques and all the knowledge fresh out of school, and he has 30 years of invaluable clinical knowledge. So all my patients I discuss with my father, so you kind of get a 2-for-1 doctor special.
I like it.
We also do physical therapy modalities, which help us align the spine through posture and work the core muscles. We offer nutritional supplementation, which helps the joints and regaining the nutrition, which is very important. So we can attack a problem from all different angles, and that really gives us an edge on helping people, and that's why we get results many others don't.
And that's so true, because you want to treat the whole body, not just one specific area or one symptom.
Exactly. You try to get to the root cause of the problem and not just treat the symptoms.
Awesome. Okay. Well, thank you again for being with us. It's always great to have you here.
Thank you so much for having me.
Great. Coming up next on Aging Gracefully, we'll speak with Tiana Ramirez from the Fred Astaire Dance Studios. So stay tuned, we'll be right back. Tiana Ramirez from the Fred Astaire Dance Studio is back to further discuss the medical benefits of dance with us today. Hi,
hello.
Welcome back.
Thank you.
Thank you for being here.
Now
we know that dancing, ballroom dancing, is a fun activity for people of all ages, especially as we start aging a bit more.
Yes.
It becomes something more of a benefit to your health. Right?
Absolutely.
Can you tell us a little bit how that happens?
So we kind of spoke a little bit last time about how dancing, ballroom dancing, any dancing, can be considered a form of exercise.
Yes.
So regular exercise just promotes general health to all of us. You know, it even improves chronic illnesses such as, you know, diabetes, high blood pressure, high cholesterol, which are some of the leading causes of heart disease. You know, in addition to that, some of the proven health benefits are, you know, lower body muscle endurance, overall endurance, flexibility, strength, balance, gait, you know, walking ability.
Which is, I mean,
huge. We gotta walk.
Do it, right?
You gotta
move.
do it. You know, and bone mineral content, which is important to prevent osteoporosis.
Okay. And
So-
that's something, I mean, with falls being so prevalent, especially as we get older, how have we determined that dance can help prevent some of those risks?
Well, through like balance,
Yeah.
just overall balance and gait, the walking ability,
Sure.
and improving lower body strength.
Okay.
And ballroom dancing does improve all of that. And studies have shown that through those improvements, there have been a decreased number of falls in older adults, which
So-
is huge.
Yeah. So again, just in general, I mean, you're getting in there, you're moving your body, you're strengthening all of these different muscles. So
You find muscles that you didn't even know you had.
right, and I'm
Like,
sure
oh, that
especially
hurts. Oh, where'd that
after
come
you
from?
start. But in addition to that, it also improves your mood. How does it affect your mood? What does that mean?
You get to smile and be happy all the time. No, I mean, a lot of people say that they feel better after they exercise.
Sure.
And that can be attributed to endorphins and dopamine that are released in the brain. But interesting enough, day to day, there are couples who come in, a lot of times the guys, the gentlemen are very nervous and they don't want to be there and they don't have a very pleasant mood right away.
Right.
But after 45 minutes of dancing, it changes. And there are actual, studies. In 2015, there's a medical study stating that, mood scores were higher
Yeah.
after a period of time when adults were ballroom dancing. The more they danced, the happier they felt. So absolutely, the mood is definitely affected through dancing.
Okay. Are there any negative health consequences to dancing that we know of?
No, none at all. No, just kidding. Okay, what do I want to say there is? With any physical activity, it does pose risks to knee injury or back or shoulder
Sure.
or just muscle and joint pain in
Sure.
general. They're very mild. Personally, I have a 40% tear in my left knee and my MCL. My physical therapy is actual dancing, and that was given to me by my doctor
Yeah.
to tell me to go ballroom dance and
Yeah.
keep doing what you're doing,
Yeah.
walk it off,
Yeah.
because it's so helpful.
Yeah.
And
And I think with anything, whether it's dancing or exercise, when you start something new like that, I mean, obviously, you should ask your physician what they recommend. But again, you start slowly, right?
Absolutely.
When somebody comes in, you don't just get them into like the tango or the samba or something.
No.
Tell us how you actually work people through from the beginning
so it's
forward.
It's that saying, you have to walk before you crawl.
Right.
From the very beginning, it's just introducing, how what you do in everyday life can form our basic dance steps. Walking forward, walking back, walking side. I'm not saying that ballroom dancing is just walking, but we don't realize what we do every day naturally is exactly what we do in dancing. We just do it to music. Sometimes we do it with a little bit more energy, with passion, with heart, so in the beginning we start slow.
Yeah.
And then everybody, has their own dreams and wants and goals in dancing, so then they each are tailored to what everybody wants.
And again, I mean, when you think about it, anything that you do, the walking, walking backwards, how many times do people actually walk backwards? But that is so good for what you were saying, about your balance and other daily routines that you have in your life that you don't think about. So yes, dancing is such a tremendous, tremendous benefit. What's the age range of the folks that you see come in there?
I would say the general range is between mid-60s to late 70s.
Okay.
We do have someone as young as 3.
Aww.
And someone as old as 94. So dancing is timeless and truly ageless. So it fits every season of
It
life.
fits every season. And I know that we've talked about it before, but people can come in, just go into your studio,
Yes.
kind of have a look at what's going on. So you have group dancing. People
Yep.
can come in.
Yes, we have group classes every day, typically around 7. but we have our parties on Friday night, and that's when a lot of students like to bring in somebody who's never been there before, so they can check out the studio and see what it's about.
Okay. Can you give us your website again so people can find out where you are?
Absolutely. SarasotafredAstaire.com.
Awesome. Thank you again for being here. Always a pleasure.
Thank you so much, Nancy.
Thanks for watching this week's episode, and you can watch previous episodes on our website, www.snntv.com. Tune in next week for another episode of Aging Gracefully on Suncoast FYI.